Hi, this is Dr. Desmond, gastroenterologist. Today I want to ask a question that many patients have been asking me recently. So I have patients that come and see me for, say, parietal bleeding, abdominal pain, or they want a screening colonoscopy. So they ask me, Doctor, when you do a scope, if you find the polyp, will you remove it in the same setting? So my standard answer is that, of course, that's the job, that is the aim of the colonoscopy. So if you come to me or come to most gastroenterologists or probably surgeons in Singapore, you have a colonoscopy, we see a polyp, we will take it out in the same spot. So the reason being that polyp are precancerous, colon polyp are precancerous, if you don't remove it, there's a 10% risk that they may progress to become cancer. So when we do colonoscopy, we find the polyp and we remove them if we find them. In fact, that is the whole idea of colonoscopy. And that is exactly the same reason that colonoscopy is better than a fecal occult blood testing or fecal immunochemical testing, because when we find the polyp, we will cut it out. If we find cancer, we send for surgery. Whereas a fecal occult blood testing test for blood in the stools, by the time there's blood in the stools, either the polyp is very huge or the polyp may have become cancer. So fecal occult blood testing look mainly for cancer and advanced polyp. Polypectomy, colonoscopy can look for cancer, advanced polyp, and also smaller polyp, which when we cut it out, we can prevent cancer. So why do people ask this question? Actually, under very few circumstances that I will not remove the polyp when see one. Number one, if the patient is on antiplatelet agent or anticoagulant such as warfarin, Xarelto, or other antiplatelet agent, or if they're on Plavix or Plavix plus aspirin. Because when they're on antiplatelet agent or they're on anticoagulant, if I see a polyp, if I cut it out, the blood may be so thin that they don't clot. And then there may be a lot of post-polypectomy bleeding that make the scope dangerous. But one step back, before we do a scope, we actually ask the patient, do you have any condition in the heart that require you to take an antiplatelet agent, or you have any abnormal rhythm that you need to take an anticoagulant, or do you have history of stroke or heart attack before? We actually routinely ask this question. So if patient is on anticoagulant, we should not even attempt to do a scope, because what's the point of doing a scope? When we see a polyp, you can't cut it out. You see a cancer, you dare not do a biopsy. So only under very rare circumstance that I've encountered before that we do a scope, knowing that if we see polyp, we don't take out. We see cancer, we can't biopsy because patient is on anticoagulant. But I would say most of the time, we will only do the scope when we have stopped the anticoagulant or the antiplatelet agent for the appropriate duration according to the medicine they're taking. So number one of not taking a polyp is when they are on anticoagulant. But that is rare because we won't even do the scope for them. We'll delay the scope until we have stopped anticoagulant. Number two, if the polyp is too large that I don't feel confident that I can cut out the polyp safely in entirety. So sometimes we have a big polyp that I don't think patient can benefit from a polypectomy during the scope. Then what I will do is I will inject some dye. We call it tattoo, same as the tattoo the arm, okay? Inject some dye onto the lining of the colon around the polyp. So, and after the scope, I will tell my patient that your polyp is too huge. Doing a polypectomy through the scope may be dangerous. I can puncture your intestine, or I may cause severe bleeding. Such patient I send to my surgical colleague. They will do a laparoscopy, look for where the polyp is by looking for the tattoo, the dye, and they will chop it up and join together. So very large polyp that I do not think I can remove them safely and entirely through the scope, I will also not do a polypectomy. Other than that, there are very few instances that we see a polyp we don't take out. So to answer my patient's question, I will tell them, yes, if I do a scope, we see polyp, we take it out. Okay. So, but I have seen some patients that have colon polyp on the scope and they're not taken out. They are not common. I would say that they're almost always foreign patients. In Singapore, if you do that, unless you have a good reason, you are not going to you may be charged for malpractice. In Singapore, unless you have good reason, you leave a polyp behind without doing colonoscopy, without doing polypectomy, you're subjecting the patient to another scope, another brow prep, which subject the patient to risk. So we don't do that, okay? So I have patients actually over the years, they are actually have a scope done in the home country. They did. So what they told me was that, and the report says that, oh, the scope show a polyp. Then they pull out the scope, they wake the patient up, and they tell the patient, oh, ma'am or sir, you have a polyp in the colon. We have to take it out. We'll schedule it tomorrow. So why should you schedule a polypectomy the next day? I have seen it in several other countries outside Singapore. In Singapore, it's almost never, because you'll be charged for doing unnecessary scope. Okay, so one patient from China told me that because under the insurance policy, under the national guideline, if you have a polyp more than a certain size, they think it is safer to have the patient having this polypectomy done as an inpatient. So the first scope was done as an outpatient. They scheduled the scope done. They scheduled the second scope, a polypectomy, as an inpatient. So they say overnight for observation. This is what one particular China patient told me. And I have patients from other countries that I cannot find a logical reason. So to sum up, if you go for colonoscopy, ask your doctor, if you see a polyp, will you take it out for me? I guarantee you in Singapore, they say, yes, we see a polyp, we'll take it out at the same setting, unless the polyp is so big, too big to be removed, or the patient himself or herself is on heavy antiplatelet agent or an anticoagulant. For that instance, I would normally ask them to stop the medicine for the appropriate time and do the scope when it is safe to do. So to sum up, I almost never do two procedures for polyp. We do in the same setting. At least that is in Singapore. Okay, this is Dr. Desmond Wright. Thank you.